Today I am going to discuss the next concept of mobilization and that we should know prior to implementation of any mobilization technique, that is your barrier concept. तो क्या होता है barrier concept? Basically in at any joint when we perform the normal range of motion, we basically experience these, or it is basically categorized in this category. So with this figure, we can understand a normal joint range of motion with from the beginning, from the starting to the anatomical barrier. So with this figure, we can understand the complete range of motion of a joint. तो होता क्या है, फर्स्ट ऑफ ऑल it starts with joint play. So very small portion is consist by joint play, and joint play or accessory movement which is available at the starting or at the beginning of the range of motion, and it is not in voluntary control. Basically voluntary control means we cannot perform it separately. It is always available. It is a mandatory component for a normal functioning of a joint. तो ये स्टार्टिंग ही में होता है, बहुत छोटा सा अमाउंट होता है जॉइंट प्ले का. वी कैन अंडरस्टैंड व्हेन यू keep your hand relaxed. We can take the example of your metacarpophalangeal joint. Here we can move these phalanges in respect of metacarpal head. So this is joint play. Next is your active range of motion. So from the beginning, from the joint play to the limit of active range of motion. So here we can understand it with this diagram. Suppose it is the diagram of knee, or you can imagine knee or elbow. So this is the beginning, and here the joint play is remain available. So this is the joint play. From here to here, I can perform the range of motion. After this, we cannot move the limb further. So this is the limit of active range of motion. So it is represented from here, from the beginning, from the neutral to limit of active range of motion. So this is your active range of motion. Next is your passive range of motion, and after that paraphysiological space. In between it is your physiological barrier. So how to identify physiological barrier? After completing your active range of motion, when you apply the further pressure passively with the help of external force or with the help of your another hand, I can press the elbow further, and just after pressing it, we can feel the elastic resistance. So that elastic resistance is basically your physiological barrier. In pathological condition, we can feel it leathery and feel or soft and feel. That is also the example of your physiological barrier. Sometimes because of the capsular or ligamentous pathology, it is reduced. Suppose in case of post-fracture stiffness, when you try to move the limb further, you may feel the elastic resistance prior to the completion of normal range of motion. कभी कभी shift हो जाता है. तो this is your physiological barrier, and if you try to move it further, so you will feel the bony clunk or bony obstruction. That is the last end, and that is the limit of your range of motion. After that you cannot perform any further movement, and that is represented by anatomical barrier. So this is the last point of your range of motion. So in active range of motion, basically all the exercise program can be implemented. From the limit of active range of motion up to the anatomical barrier, we can perform the mobilization, and specifically if you perform manipulation, it is basically performed in paraphysiological space, which is found between physiological and anatomical barrier. With this figure, basically this figure is transform with the example of any joint, your elbow or knee. This is very small amount that is representing the joint play. From here to here, it is the limit of your active range of motion. And from here to further here, basically this arrow is not correct. From here to first and second line, it is the space which is representing the limit of passive range of motion, and further from the, this is your physiological barrier and this line is representing your anatomical barrier. So this is the paraphysiological space where we can perform the manipulation specifically, and this line is basically representing the mobilization limit. So from the physiological barrier up to the anatomical barrier, basically we perform the mobilization. Now come to the next figure. Again, this is representing, this figure is representing the normal range of motion or component of a normal joint. First is neutral position. From here to here, this is the limit of joint play. From joint play to limit of active range of motion, this is from neutral to here, it is basically representing your the area of exercise. From here to here, it is representing the limit of the limit of active range of motion to the anatomical barrier. It is representing the mobilization where we can perform the mobilization, and this is the area between paraphysiological space and anatomical barrier where we perform the thrust. Now come to the pathological or abnormal condition. This figure is representing how the barrier is shifted in any direction or how it become decrease. Any range of motion could be affected with some pathology or some abnormality depending upon the involvement of structure. Here, in case of muscle spasm, basically your limit of active range of motion is reduces. It is shifting towards the active range of motion. For example, if my joint is free to move in this range and I am suffering from any type of muscle spasm, especially of your triceps muscle spasm could be there. So what will happen prior to completing the 135 or 150 degree of elbow flexion, because of the tightness or because of the muscle guarding, this limit may shift, means range may reduce. It may limit up to the 100, 90, whatever, depending upon the condition. So your limit of active range of motion will be reduced, means you will not be able to complete your normal range of motion. Next is, suppose there is any pathology which is related to your joint capsule or ligament, what will happen? Basically your physiological barrier will shift toward the limit of active range of motion. This line or this arrow is showing the reduction of this space, means whatever you feel after the completion of range of motion, means suppose you are feeling the physiological barrier here, so it may feel prior to the completion of range of motion. You can take the example of your periarthritis or any type of joint stiffness where hypomobility is existing. In case of post-fracture stiffness, if there is no any bony involvement, if it is because of the tightness of your joint capsule or ligament, then this barrier could be shifted toward the your active limit of active range of motion. And the last is, if suppose there is any pathology which is related to your bone or joint, there may be the ankylosis of joint, there may be malunion of bone, or there may be intra-articular mice or loose body. So this last barrier, anatomical barrier, could be shifted towards the paraphysiological space or limit of active range of motion, means you will not be able to complete your range. Prior to completion of all these components, you will feel the bony restriction. So it is very important concept which we should know prior to perform any mobilization technique which is used to increase the mobility of joint.